Hello everyone, today video is about how and what to study for MRCP Part 1 and 2 UK. So coming to Part 1 is a basic test about investigations, diagnosis, some basic mechanism about the drugs they will ask you, some basic interactions they will ask. And Part 2 is mostly about with these elaborate questions they will give you CT, MRI and ECG, and with that you have to correlate and write your answers. So best of 5 choices are there with no negative markings. Now coming to what to study for part 1 and 2 both, you require only past medicine, past test and a book called Notes and Notes. If you have any confusion regarding any question, you can refer for Harrison's, Mrcp, or you can check on internet on up to date and all these apps. But don't go for any other books because it is a waste of time, nothing else. No need to go for any coachings. It is absolutely waste of time, nothing else. Past medicine, past test and notes are enough. And reference book I will suggest you Harrison's or up to date applications. So after that, some tricks I am going to tell you for cracking the exams in a easy manner. Trick number 1, don't memorize the answers. Don't memorize the past test, past medicine answers because they will change the question slightly and your answer will go wrong. So try to learn the concepts, don't memorize the answer. If your concept is right, your answer will be right. Because question they will change some options, they will change some words and you will get a similar but a different question. Second trick is that trick number 2, don't go for easy answers. Always try to do most of the difficult questions. The more you go for the difficult questions, the more you make the difficult questions right, the more numbers you are going to get. Because easy questions everyone will mark and that weightage will go down. So even if you take number of questions, right questions more than 120 and most of them are easy, you are not going to qualify. But difficult questions, if you make less questions also correct, they are going to give you a good weightage in the exam and good marks in the exam. Number 3, don't trust all the answers in past test, past medicine and notes. Wherever you are having confusion or you are having a contradiction that this is not the correct answer, you always refer to the standard books or standard applications because many answers are given incorrect, especially past medicine and notes. Past test is somewhat better. And don't rely on any coachings and all that. I'm repeatedly telling you because it will extend your course and there will be not much benefit. Coming to part 2 many is basically a easy exam. Its passing rate is very high, but the problem is this questions are very lengthy, so you must practice how to tackle long questions because there will be extensively long questions and on the day of exam you may get frustrated reading them. Along with that there is CT, MRI or ECG, basics they will ask. Don't go for extensive CT, MRI and all those books. In ECG they will ask you heart blocks, QT prolongations, arrhythmias, electrolyte disturbances such as hyperkalemia, hypercalcemia changes. In X-ray they will ask you pneumothorax, consolidations, hydropneumothoraxes, cancer changes. In MRI CTs they will ask you mostly infarct, bleed, subarachnoid hemorrhage, some infections like toxo, some post HIV changes like PML and lymphomas. So all these basic questions they will ask you. You no need to go for extensive reading of radiology. So basics if is right, you can crack the exam and that is only is required. No need to go in elaborate lengthy topics. So these are the basic changes for MRCP 1 and the tricks. Don't go for extensive reading. Take it as a very light exam, simple exam. They are going to check your basic knowledge only. So all the best and let's meet in the another video for paces.